Paramedic 2, the adrenaline trial. The Paramedic 2 trial was led by the University of Warwick, conducted in 5 NHS ambulance trusts, and included over 8,000 patients who were in cardiac arrest. Patients were allocated randomly to be given either adrenaline or a placebo. Clinical question: to be or not to be? In adult patients with out-of-hospital cardiac arrest, does the administration of epinephrine compared to a placebo improve patient survival? Background: there is limited evidence for the drug treatments used in advanced life support. It has potential beneficial effects by increasing the aortic diastolic pressure and thus increasing coronary blood flow. However, harmful effects have also been hypothesized, including increased myocardial oxygen demand, leading to thrombosis and impaired microvascular flow. There has been conflicting evidence as to whether the drug is beneficial in cardiac arrest or not. A large Japanese observational study reported higher rates of return of spontaneous circulation, but worse neurologic outcome. As a result, the International Liaison Committee on Resuscitation called for a large-scale randomized, controlled trial to see if epinephrine is safe and effective in cardiac arrest. Design: randomized control trial is the gold standard in clinical research, which belongs to the experimental studies, where it is most commonly used to compare a potential new drug or efficacy of an existing drug against a standard of care or placebo. Treatment assignments are randomly generated using a computer allocated in a 1-to-1 ratio, which consists of a treatment group and a controlled group. Each pack was uniquely numbered. Identical pre-prepared packs provided to the ambulance services containing 10 syringes with either 1 mg epinephrine or 0.9% saline. Ambulance services entered data into a secure portal. Odd ratio adjusted for age, sex, interval between emergency call and ambulance arrival. Interval between arrival of ambulance and administration of trial agent. Initial rhythm, cause of arrest, whether arrest was witnessed or whether CPR performed by a bystander. Exclusion criteria: pregnancy known or apparent, anyone under the age of 16 years old. Cause of arrest was asthma or anaphylaxis. Administration of epinephrine prior to arrival of trial-trained paramedics. Outcome: primary outcome: survival at 30 days was greater in the epinephrine group compared to the placebo group. Epinephrine, 3.2% survived. Placebo, 2.4% survived. Secondary outcomes: survival rates at various time points were significantly better in the epinephrine group. Length of stay in ICU and hospital did not differ. Neurological outcomes were possibly worse in the epinephrine group, as when assessing the number who survived with severe neurological deficit. The difference was statistically significant with worse outcome in the epinephrine group. Conclusion: it resulted in a significantly higher rate of survival at 30 days when compared to a placebo. And there was no significant difference between groups with a favorable neurological outcome. However, more survivors in the epinephrine group had more severe neurological impairment. This trial suggests epinephrine improves 30-day mortality, but it may be at the cost of worse neurological outcome. Subscribe to the channel for more.